introduce you guys to Dr. Jarod.
Yeah. Hey guys, it's me, Dr. Jarod. Thanks for joining. If you're a part of my audience, this is Dr. Hunter Hoeper. He's awesome. He had and has a practice in Pittsburgh, Pennsylvania, and is also in Pensacola, Florida. We met at an ICAK conference. I don't remember what year, but that was in Arizona, right?
It was in Nashville, actually. Or no, Atlanta. It was in Atlanta in like 21 or 22.
Yeah.
Around that year.
Yeah. So we both do a lot of muscle testing in our practices. We look at the person, as a whole person. We're not just looking for structural health, but we're looking for chemical health, so nutritional health, emotional health, spiritual health, right? And how those all interweave with each other. And so he's awesome too. He's a great guy. I love how outspoken he is. He's been banned 4 times from Instagram.
I've definitely lost 2 accounts, and then the third one I've been locked out of, and then the fourth one is the one I'm at now.
Yep.
And so I've archived a bunch of different posts because I just found that a lot of this stuff I was posting on Instagram to get views or to get information, there's a lot of fear mongering, or it's the idea of creating some sort of an emergency in people's minds that I just don't really connect with anymore.
Yeah.
And so that's why we are doing this live, and we asked to get some questions. And I think it's going to be good to talk about, because a lot of the questions we got are very, what do I do for this?
Right.
What do I do for arthritis, tinnitus, any of the itises? It's like, please help me.
Mm-hmm.
And Dr. Jarod, I would love to hear your opinion, but I'm going to give mine first. The answer is I don't know, right? I don't know what I'm going to do specifically for your arthritis.
Uh-huh. Is that it?
I mean, yeah, expand on that. I mean, I know you believe the same thing as me.
Yeah, I mean, well, basically, there's no formula to health. There's no formula to recovery from a condition, right? There's 2 sides of health too. So there's recovering from the negative to get to neutral, right? Which Dr. Hunter will talk about this probably. And then there's the progression of you becoming a better version of yourself than you ever have been before, right? So, and then also when you're just thinking about any condition, right? Does any person recover from a disease in the same exact way as another person, right? Whether it's, something serious like cancer, or whether it's a cold, or whether it's, arthritis, right? Does anyone follow? Is it always an exact formula to fix a condition? No. And that's why, of course, medicine, health is bio-individual, right? And especially in our field, we're not just thinking physical medicine. We're not just thinking what kind of drug do you need. We're thinking, okay, what emotion happened that triggered the muscular imbalances that are connected to the lung that's now causing a shoulder imbalance, which then over the years has caused an disequilibrium in the shoulder joint, which now is finally turning into arthritis, right? So then you just have to follow the trail all the way back to what was that moment in time, whether it's emotions, chemistry, whatever, that triggered the cascade of events that has been not tended to, right? Your body's like a garden, right? And every garden is different, and every garden needs different care, different input, different fertilization, water, sun, aeration at different times to have a healthy, vibrant soil and that bears fruit and progresses, right? So I think a lot of times people think of chiropractic as more mainstream medical, and that it is helping you recover from something. And while chiropractic is amazing at that, the beauty of chiropractic is it actually helps you become something. So yes, recovery is awesome. And that's what most of the questions came in from. How do I recover from this? But actually, that's only 25%, I'd say, of the journey, right? Once you get recover, then it's about becoming. And so, that's what I would say. And what's cool about chiropractic and neurology and brain development and the organization of the body is that there's no limit to it, right? Of course, we're all human. We're all limited because we're not God, right? God is the only unlimited, all-knowing, never can run out thing, right? But we are made in his image in the sense that we can recover, but we can also grow and develop for the rest of our lives, right? And chiropractic is an amazing, beautiful tool to help facilitate, speed up, and steward that as we go. So,
Yeah, and I know I can speak on both of our behalves when we say that chiropractic is a philosophy, and the philosophy is truly that there is an intelligence that is within our body that we are created with, and that intelligence can run your body better than 1,000 medical doctors that have been studying your body for 100 years.
Yep.
Your liver is doing 350 processes right now without you thinking about it. There are trillions of cells in your body that are organized. That's why they're called organs, to all work together to make sure that you are constantly adapting and reorganizing yourself to continue living. And so this intelligence is, in chiropractic, what we call the innate intelligence. And this is the intelligence within the body that makes sure that when you get a cut right here on your forearm, you don't have to worry about growing an eyeball. Your body knows to put skin there again, right? Because it's all organized. And so in chiropractic, really what we are doing is making sure that there's no interference in the nervous system. And the nervous system is what is sending all the messages and receiving all the messages from the body. And so what we want to make sure is there's no mixed signals, so that the body is able to reorganize and self-heal at its highest capacity. That's what we're doing as chiropractors. And whether we do that through a variety of different methods, which is what's amazing about chiropractic, is there's just so many different ways it can be done, but all of them, at least chiropractors that focus on principled chiropractic, it's all about removing interference from the body to let that innate intelligence express itself at the highest capacity to express life.
Yeah. So because the body wants to heal, right? And sometimes just things, life, stress gets in the way. And the chiropractor's job is to not heal the body, but to just remove as much as possible the stressor, right? And that's what we would call, a subluxation. Subluxation is misalignment in the spine or in the nervous system, really, that is that disconnect. And so the chiropractor just acts as a vessel to come in and help fix the disconnect, so that the intelligent design that God ordained and God wired into the body can continue to be effective. And then the body heals itself. And that's the amazing part of creation, really. So,
and this is why it's so important to have chiropractic care, because chiropractic care isn't just to get you out of low back pain. And when somebody comes into my office, and I tell all my patients this, there's really 4 states that a nervous system is in. The state a nervous system in is, I'm in pain and I want to get out of pain. I'm not in pain and I don't want to get into pain. I might be in pain or might not be experiencing pain, but regardless, I want to improve myself. And I want to improve myself so that I can make life better for everybody around me. And as a chiropractor, my goal is, regardless of whatever step you're in, I'm moving you and keeping you to the 4th step, because ultimately that's where, as a chiropractic clinician, I can make the biggest impact for everybody, is to make sure that their nervous system is expressing life at the highest capacity. And it's just so interesting that I think about, there's people that walk around that are, in the government, that make decisions on whether or not we're going to go to war. There's people that are cops that carry guns. There's people that are surgeons that operate on people while they're induced, and those people get migraine headaches, right? Those people get low back pain. And imagine what that does to their ability to perform at their highest capacity in their role. And so my mission is for people to not experience that, to really express the highest form of themselves, so that ultimately they can do their best at what they're meant to do, what their purpose is. So, Jarod, why don't you tell us a little? we got through a lot of stuff here. Jarod, why don't you tell us a little bit about what your practice is like down in Fort Myers and what you see a lot of?
I see out families, so mostly young families is my patient base. I mean, I have 2 weeks old to 90 years old. So I'll get anything from like a hot low back case. That means like really bad disc herniation, can't walk, can't go to work, can't sit, can't lay down, can't sleep, right? I get those a lot. I get a lot of nutritional cases. By that, I mean like tired, exhausted, stressed out, can't calm down, hormones are a mess, can't go to the bathroom, can't sleep well, just not feeling like themselves, irritable, right? All of that is really that first state of the nervous system that Dr. Hunter's talking about, right? And it's also an emotional state too. That's the thing, is like your body reflects your emotions and your emotions reflect your body, right? Even when it comes to posture and in the way your face looks, right? But you're going to show health or you're not, right? And so those are the types of cases I see a lot of, and then a lot of pediatrics too. There's a lot of kids out there who are dealing with a lot of the toxins in our world, whether they're toxins from the medical schedule or whether they're toxins from the food, the air, mold in homes, because I'm here in Southwest Florida. There's a ton of mold cases. So those are a lot of what I see. And again, it's all about whether they're coming in for a nutrition problem or whether they're coming in for like a pain and nervous system problem. The solution is the same. You help the body remove the interference so that the body can continue to progress, self-regulate, and self-heal. So yeah, those are my cases. Usually, and then once people are with me for a little while, they usually stay because they feel really good. And they don't want to stop, and they value the care, and they see the difference it's made on their lives. I mean, and this is not to pat myself on the back. This is just chiropractic and learning what I know, right? And I always tell people, I have a lot of interns that come and shadow me, and they're always like, oh my gosh, like I want to be you someday. And I'm like, I'm not special. I'm not special. I just took the time to this technique, to learn these things, to study the body, to stay humble. And if you do the same things, you'll be just as awesome at helping people heal, because it's not like I have magical powers, right, that help people heal. It's the body that heals. And so yeah, that's my practice. I'm bursting at the seams. It's amazing. Yeah, I love it. I mean, you name it, I've seen it. I've supported cancer cases, headaches, migraines, a lot of pregnancy and pediatrics, which is so fun because even like one of my favorite things is like I will have a tired, burnt out mom come into my practice. She's had 2 kids maybe. She would like to have another baby, but that's like barely on her radar because she just doesn't feel like herself. She's exhausted. She's irritable with the kids, with her husband. Relationships are strained, right? She starts crying because she confesses she feels like she doesn't feel like she's a good mom, right? And so we start restoring her nutritional reserves, right? We help her detox a little gently, whether she's breastfeeding or not, right? We have to keep that in mind. And then within 6 months, she's feeling great, she's awesome, and then all of a sudden they're not even trying and she's pregnant, right? And so that's just like so fun to help create that terrain for like where her body's so healthy that it's time to have another healthy baby. And then I get to support the mom all through the pregnancy and do like the pregnancy chiropractic care, which is so gentle and beautiful. And then they bring in the baby, and the baby, you know, at sometimes like a week old, and I get to make sure that the baby's neck is just in the right spot so that life force that God gave it can be fully expressed and can ripple through the baby's body, and we make sure the baby's latching. And that's my favorite. I love that aspect of my practice. It's so fun. And then of course, helping the grandmas and grandpas with their hip replacements and things like that. That's awesome too, because all my patients are like family to me. They're awesome, and that's how I treat everybody. But yeah, that's my practice. Family style. It's membership based, because once you're with me, I want you to stay with me, and because it's good for you. You can go somewhere else, it's fine. But it's just chiropractic care is more important than your allegiance to me, is what I'm saying. And so, yeah, that's my practice.
Yeah, very similar. I work with a lot of women and a lot of families, and I really find that family care is one of the most important things people can engage in, right? I mean, what is the point of coming in when you're going to just leave your kids and your husband home to get sick? It doesn't make much sense to me. Everybody benefits from getting this care because, again, we're not just seeking out a problem that you might have convinced yourself you have because you spend a lot of time on TikTok or on Instagram getting convinced you have these problems. You're coming in because you want to better yourself and you want to improve your situation. And regardless of what's going on in your life or in your body operates at a higher capacity when there's no interference in the nervous system. And whatever that looks like, and one of the things that it just came into my mind is so many people, they associate being sick with not being healthy. And this is something that, I really got to thinking about. Like, for example, let's just say you decided to go out to get Chinese food and you ordered some lo mein and you ended up with ptomaine, right? You're throwing up, you have diarrhea, all this stuff, right? Your body is sick, but you're healthy because your body is getting rid of it, right? This is what your body is naturally meant to do. And a lot of people associate whatever they're experiencing right now as a symptom as them not being healthy and that there's something wrong with them. And if I'm not the first one, then I want to be the first one to tell you that just because you're sick, it doesn't necessarily mean that there's something inherently wrong with you. You're created perfectly and to heal. And so again, my job is simply to come in, have you come in and to remove the interference and whatever that interference is and support your body so that it can overcome and express itself. This is really the most important thing, whether it is emotional trauma or emotional toxin, it could be environmental toxin. There's lots of different ways, and there's lots of different ways people can get sick or get unwell. And I think as time goes on, we find more and more. And now we have experts who know more and more about less and less until the absolute expert knows everything there is to know about nothing, right? This is where we're headed with modern medicine because of something called inductive reasoning, which is there to supply knowledge, but it doesn't supply understanding. And so when you come in to an office like mine or like Dr. Jarod's, we're focused on you, the individual. We're not focused on the problem, we're focused on you, because regardless of what we might think the problem is, we don't know how your body knows best to resolve that, because we are all just as different on the inside as we are on the outside. And so that level of specificity that we get to in appointments, doing kinesiology, doing muscle testing, using frequency medicine, that level of specificity is information that we get from your body. It's not something that we read somewhere. It's not something that we're guessing at. There's no protocol for this. It's very specific and individualized for that soul that is there in front of us on the table. And even though it's very specific, or at least I'll speak for myself, I don't know how long it's going to take for you to get better. And I don't know if you're going to get better. What is important is the interference is gone, because in my understanding, that is the best way for the body to be able to resolve its own imbalances and disharmony.
Excellent.
Yeah.
Agreed.
Okay. So my practice is in Pittsburgh, Pennsylvania. I do a lot of virtuals right now when I'm in Florida, which is 3 weeks of the month, but I'm moving back to Pittsburgh. I had a couple live questions about when I'm moving back to Pittsburgh. And just like, how do we resolve your health issue? The answer is, I have no idea. Probably the next couple months. I just fly by the seat of my pants with most things. I let God guide me wherever I'm going to end up. So if I had to put an estimate on it, I'd imagine probably the next 3 months. But if you asked me 2 years ago if I would move to Florida in 3 months, I would say there's absolutely no way that could happen. And yet here I am, and now I'm moving back. So we're all over the place, right? It's just all guidance. And sometimes you have to be okay with that. That's what faith is, right? Faith is just knowing. That's why we have faith. Reggie Gold said it best. You could be a good man, you could obey all God's laws, and you can still get struck by lightning. And that's why there's faith, because sometimes the answer is that there is no answer. And that's why we have things like faith. And that's why we do the work that we do, because we are here to understand the body. We're here to remove interference from the body, and we're here to let the body heal on its own.
Yeah. And like just a lot of the questions, like, how do you fix this? How do you whatever? And when we say we don't know, it's because we don't know. Well, at least when I say I don't know, it's because I don't know your story, and I don't know what your body is going to tell me until I'm interacting with you.
That's right.
Right. So because there's no formula to how everyone develops the same condition.
That's right.
So it doesn't mean that we don't have the tools to figure it out. It means that there's no formula for health that fits everyone. And so that's why working with someone is very powerful. You can try all the formulas in the world, and they will probably help you to an extent. They may not. The protocols, the formulas, whatever. But that's why working with someone who knows how to read the response of your body. So basically, the premise of what we do is, does a stimulus to the body calm it and lead it to healing, or make it anxious and push it further away from healing? Right? That's all we're looking at. And so when we can see and watch the body fluctuate between those two responses, it's kind of almost like a yes and no, but it's not. It's really, is it leading it to the path of healing, or is it not? Right? And so when you have a doctor who knows how to determine how your journey is going with those types of responses, whether it's through their taking a good history or muscle testing or reading the nervous system, that's how you find your way out, right? So, and that's how you progress out and onward, like I was talking about at the beginning of the life. So just wanted to clarify that.
And that is exactly right. There are tons of things that contribute to whatever symptom you're experiencing. And I truly am of the belief that there is enough information on planet Earth to solve any problem. It's just a matter of putting it in the right order.
Yeah.
And so the way that we put it in the right order is not by me using my intellectual mind, but rather me inquiring to your body about what kind of clues it's giving off, and then use those clues, put those in the right order, and then let the paint dry, watch what resolves, what doesn't resolve, and then reformulate it. And so many times when I have intense discussions with people about what I do, and they ask, is it scientific? I say, absolutely not. And it is not scientific because science is measurable and predictable. So, and when you do chemistry, chemistry is a science. Mm-hmm. If you mix these two things together, you're going to get this every time, right? If you plant an apple seed, you're not going to get pickles. Right? It's science when it's predictable. And that's why they call modern medicine medical practice. They call it a practice because a medical doctor, cannot predict how any medication they give you is going to react in your body, because it's absolutely 100% not scientific. Sometimes they'll give you a blood pressure drug and your blood pressure will drop to the floor and you'll start passing out. Sometimes people get on a blood pressure drug and they go into kidney failure. Sometimes they get on a blood pressure drug and their blood pressure gets normal, but they get double vision. And so for every single person, it's different. And that's why you can't say it's scientific, because there's no science behind it. There might be science in the knowledge of how they formulated it, but because everybody, like I said, is just as different on the inside as they are on the outside, there's no predictability. And this is something that I use this kind of reasoning to turn around on anybody that asks me if it's scientific, because there's nothing scientific about how individual you are when you're coming into my office. That's why I'm there working directly with you, because medicine right now, unfortunately, works on averages. And if you have somebody in the room next to you, I want you to take a look at them and tell me which one of you is average, okay? And the reason I say this is because I don't think anybody would consider themselves average. Everybody is very unique. Everybody is very individual. But what they do is they'll take a room of 100 people and they'll take all the temperatures and they'll say that the average temperature is 98.6. And if you took every person and you measured them against that, you'd have some people that are higher and some people that are lower. But this is lower, and this is how they determine what average is. But I'm sure you'd agree with me that nobody is average. But this is what they use and try to pass it along as science. And it simply is just not the case with how any of this works, with how your medications work, with how your body works, because you have DNA that's just as different from the person next to you, which is just as different from the person next to you. And it's impossible to know how any medication is going to react, right? Somebody could have, what do they call them, like on commercials? For your everyday normal headache, like headaches are normal and like it's normal to get them every day. And they'll pass along something like ibuprofen, and somebody could take one ibuprofen and their headache goes away. And somebody might take one and it doesn't go away, so they decide to take two and then it goes away. And then the next person might get headaches every day and two doesn't make it go away, so they take three and the headache goes away, but they get double vision and they decide that double vision is better than the headache, so they're going to live with that. And then the next person could start vomiting blood from taking it. And so there's no science behind it. And anybody that tries to lead you down that path, I think, again, is being a little disingenuous, or maybe they just haven't thought about what science actually is. And so what we're not dealing with is, it's not science, it's understanding of the body. It's a philosophy, and that philosophy is truly that there is a wisdom that exists in every single person on planet Earth that reorganizes the matter at all times in order to adapt until the point you can't do that anymore. And it is my personal belief that a person's life should look just like the burning of a candle, where it starts at the top and it burns the same the whole way to the bottom, flickers twice, and it goes out. And you can't get out of this world alive. Okay, so for all the people that think they are going to biohack their way to infinity, it doesn't exist. Everybody dies. And so it's how you want to live your life, the impact you want to make, and how you want to express your life force that I'm most concerned with. That's what I got on that.
I'd just like to add one more thing, and I think we can probably wrap this up. But Dr. was it Jeannie Ohm? Do you know her? She was in pediatrics.
No,
I might be butchering her name. Sorry. But she passed. But she would say some of the best evidence, because everyone's like, oh, what are you doing? Is it science-based? Is it evidence-based? She would always say some of the best evidence is human physiology. And what that means is some of the best evidence is just how the body works. Mm-hmm. If you're cooperating in acting as a doctor in congruence with how we know and observe the body to work, that's beautiful evidence for what you're doing, right? If you're supporting normal bodily function, that's beautiful evidence. So, and a lot of times, like the medical system versus the more alternative healthcare system or original healthcare system, it's really like, oh, well, my guessing is better than your guessing, or my hypothesizing is better than your hypothesizing. When really you just need a doctor that understands how the human body works, and then will help promote the regularity of that function. So that's it. But
thank you guys
thanks,
for hopping
guys.
on live. And I'm looking forward to doing more of these, especially with Dr. Jarod. We're aligned on so many principles about how health and how the body works. And so I'm excited, and I'm really excited to talk more about network on my future lives, because I truly believe network spinal is incredible. So I can't wait to talk to you guys more about that and begin offering that up in Pittsburgh.
Yeah, go ahead and give him a follow. If you follow me, boost up his account a little bit. Same. Likewise.
Follow Dr. Jarod as well, especially if you're in the Fort Myers area.
Yeah.
There's really not a lot of practitioners down here that are competent to his level. And so you would really be doing yourself a massive favor by making an appointment with him. If you can even get in.
All right, bye guys. See you later. Thanks for joining.
That's pretty good coming off a nap.
I think so. Is that still going?